Hello folks, in this video we're going to talk about post-operative cystoid macular edema. Cystoid macular edema after intraocular surgery may occur in about 1 to 5% of the patients. Cystoid macular edema is the accumulation of fluid in the intraretinal tissue with consequent partial visual loss. Of note, some pre-existing conditions like diabetes might increase the risk of post-operative cystoid macular edema. Let's start talking about the pathogenesis. The exact pathogenesis of cystoid macular edema remains unclear, although it's thought to be multifactorial. Surgical manipulation in the anterior chamber may cause release of multiple substances and induce inflammation. There are a few mechanisms of etiopathogenesis of the release of cytokines and accumulation of fluid in the macula to cause cystoid macular edema. First hypothesis, inflammation. Perhaps during surgery, the intraoperative or post-operative inflammation may release cytokines and other substances due to the breakdown in the blood aqueous and blood-retinal barrier. Some of these substances are lysozyme, cytokines, nitric monoxide, endothelin, or interleukin-6. One of the main substances is arachidonic acid that can be released from the uveal tissue, including the iris or ciliary body. Arachidonic acid is metabolized into prostaglandins, and prostaglandins are inflammatory mediators that cause swelling of the macula by increasing vascular permeability with accumulation of fluid. Second hypothesis is that the lens epithelial cells, when traumatized during surgery, may also synthesize inflammatory mediators, including prostaglandin. The third hypothesis was proposed by Lee and Poe in the 80s, is that irradiation to the posterior ocular structures by ultraviolet energy may induce generation of free radicals, and those free radicals might facilitate the synthesis of inflammatory mediators, including prostaglandins. The fourth hypothesis is the trauma to the ciliary body and uvea itself that can cause release of inflammatory cytokines and substances. So we talked about 4 possible pathways to cause inflammation, release of substances including prostaglandin, and consequent cystoid macular edema, inflammation, trauma to the iris or ciliary body, lens epithelial cells, or ultraviolet light damage. Let's talk about the management now. Natural history. The natural history of cystoid macular edema post-operatively is favorable. Most of the patients resolve within a few weeks. While the symptoms appear and the disease appear within about a month, within 1 to 2 months after, there is a spontaneous resolution of the course of the disease. So most of the ophthalmologists prescribe NSAID, like ketorolac or Nevanec, and a topical corticosteroid like prednisolone. Those 2 drops may help the natural history for a favorable outcome. Additionally, acetazolamide topically can be used as an adjuvant therapy. With observation and possibly eye drops, most of the patients resolve well within 1 to 3 months. If the disease becomes chronic, then other measures like intravitreal injection may be performed. The most effective intravitreal agent for the management of cystoid macular edema is corticosteroid, especially intravitreal dexamethasone implant. So we reviewed the basic concepts and main theories of the pathogenesis of cystoid macular edema post-operatively, and I talked to you a little bit about the management, with which it is observation and topical NSAID and steroids for a few weeks, followed by intravitreal steroids if it becomes chronic. Most of the patients do well. Thank you and see you next time.